Shine has put together some information for parents and schools to explain spina bifida and how it can affect school life. Spina bifida is a condition which affects the development of the central nervous system, which is the brain and spinal cord. Information from the body, such as skin sensation or temperature, tracks up nerves to the brain, and messages of movement are sent down nerves from the brain to the muscles. The main channel for these messages is the spinal cord. Pairs of sensory or motor nerves come from 31 of the vertebrae or backbones. Open spina bifida is a developmental condition which occurs in the first weeks of pregnancy. The neural tube, which will grow to be the brain and spinal cord, fails to close, leaving a gap. This leads to a split in the backbones and leaves the spinal tissue exposed and damaged. Messages between the body and brain may not get through, which is the basis for all the physical aspects of spina bifida. Open spina bifida is usually detected at the 20-week scan. Skin-covered or occult lesions are usually diagnosed at birth, during childhood or during adulthood. The lower on the spina bifida begins, generally, the less the severity of the condition. In open spina bifida, there is a sac or cyst on the back without skin covering it at birth. Myelomeningocele is the most common and serious form of open spina bifida. The cyst contains exposed spinal cord, which has been damaged by the fluid of the wound. It's associated with loss of skin sensation, bladder and bowel issues, and changes to the way the brain develops, as well as motor movement. Meningocele has a sac, but this does not contain spinal cord, so the severity of the condition is generally much less, although tethered cord can have an impact. Closed spina bifida lesions are covered by skin at birth, protecting the spinal cord in the womb. There may be a dimple or fatty lump called a lipoma, which anchors the cord low in the spine. This is called tethered cord. So how does spina bifida affect children? As a general rule, the lower the lesion, the less marked the effects, as the fewer nerves will be unable to communicate with the brain. The nerves that control the bladder and bowel are sacral nerves, the lowest nerves off the spinal cord. Most children with spina bifida have bladder and bowel issues, and for children who walk, this may be their biggest issue during school years. Messages from skin sensation on the feet may not be received. There might be patches of loss of sensation on the legs or around the bottom. Skin sensation, especially pain, is a mechanism that protects us from damage. Circulation is controlled by nerves, and blood flow to the feet can be reduced in spina bifida. Good blood flow is needed to nourish the tissues, remove toxins, and fight infection. Some children with lower lesions, from just above the bottom down, may be able to walk unaided throughout their life. Other children will walk in early childhood or until the teen years, then use aids or wheelchairs to get around. The most important thing is to be able to move where you want, when you want, and how you want. Keep a positive view of all forms of mobility. Tethered cord is a condition where the spinal cord is stuck down low in the spinal column and stretches the spinal cord. Balance can be affected by muscle tone, skin and joint sensation, brain effects such as vestibular issues, and visual perception. Children may have pain in the back, legs, or head, especially if they have a shunt. Anxiety, depression, and self-esteem issues can be linked to continence problems, difficulties with schoolwork, social relationships, or because of changes to the way the brain develops. For children with open spina bifida, learning and behaviour can be affected by changes to brain development. This is independent of hydrocephalus. If nerve messages to the bladder and bowel don't reach the brain, The child may not feel what is happening, and even if they can feel it, they may not be able to control when they go to the toilet. Urine is made by the kidneys and travels down ureters to the bladder. Without spina bifida, the bladder fills with urine, stores the urine at low pressure, and then stretch receptors start the bladder squeezing. At the same time, sphincter, which holds the urine in, opens. The bladder should squeeze until empty, then the sphincter close to contain the urine as the bladder fills again. Children with spina bifida often have overactive bladder muscles, which are tight and twitchy, so the bladder doesn't fill well. It also stores urine at high pressures and can spurt the urine out as leakage back up to the kidneys. This reflux can lead to kidney damage. Tight, twitchy bladders can cause frequency and urgency of urine and incontinence. If the sphincter isn't working in harmony with bladder emptying, the bladder might not empty completely, which is a major cause of urinary tract infections. The sphincter can also be too loose or opens even if the bladder isn't squeezing, so the bladder leaks. Assessment of what the bladder is doing is done by urodynamics, which examines the bladder as it fills, stores, and empties. If it's tight, it can be relaxed with medication, such as oxybutynin or tolterodine, or Botox injections. Drinking fluids throughout the day can help the bladder to fill. Some children try to restrict their fluids to reduce their leakage, but it actually makes it worse. Emptying the bladder completely and regularly using intermittent catheterization can help prevent infections. Catheterization involves inserting a thin, flexible plastic tube into the bladder, letting the urine drain, then removing the catheter. It's a clean procedure, not sterile, and doesn't need to be done by nurses. Because of the very intimate nature, it understandably can cause anxiety at the beginning for schools and parents alike. It's important that school staff understand what's involved and are happy to do it. Equally, school must make sure that they identify and train enough staff to provide continuity to cover absence and school trips, so the child can come to school secure in the knowledge that someone he knows will be there to support them. Training should be done by a continence advisor or specialist nurse, but together with the parents or carers, so it's as close to the way it's done at home with the same language used as possible. The procedure will be an ordinary part of the child's life. They will know the difference between their ordinary care and something more sinister, and this helps keep everyone safe. Involve the child in the procedure and encourage them to do the parts they can. Independence will come at different ages, depending on hand dexterity, body shape and movement, and learning ability, but independence is the goal for all children. Because of cognitive impacts, such as sense of time, some children may need prompting or supervision long after mastering the technique itself. Some children will be unable to pass urine naturally, so will need to be catheterized frequently. If children are catheterized less frequently than every 4 hours, they will need to pass urine in between, or they may be incontinent. Some young children may start school with a vesicostomy, an opening of the bladder onto the abdominal wall, which allows the bladder to drain completely if it is very tight and won't relax. This can prevent kidney damage until the child is old enough for augmentation, which is a major operation to enlarge the bladder. If young people find it too uncomfortable to catheterize or are becoming a young adult not yet able to catheterize independently, a Mitrofanoff can be formed. This is a channel created by surgery from the abdominal wall into the bladder that can be catheterized. It stays closed when not being used, so does not need a dressing, pad or collection bag. Good bowel management is essential for health and self-esteem. It is the most important quality of life issue for adults with spina bifida around the world. Most bowel management involves preventing constipation with good food, plenty of water, and often laxatives, coupled with effective methods of emptying the bowel at a convenient time and place, daily or alternate days. This can be by medication, suppositories, or transanal irrigation, such as peristeen or Cephora irisado, which is being used more and more for children aged 3 or older. Macrogols, such as Movicol or Laxido, soften the feces, but for some children it leads to soiling or smearing throughout the day. The continence advisor, specialist nurse, or Shine's health team may be able to make suggestions. Intermittent episodes of explosive fecal fluid can be unpredictable and difficult to manage. It is most often caused by severe constipation and called constipation with overflow. Being upright and active can help the bowel keep moving, which is great and should be encouraged. Before exercise, encourage a child to sit on the toilet and protect their clothing. Let parents know what days PE or swimming are so they can build it into their bowel management routine. As pain protects us from damage, reduced sensation to the feet or legs can mean damage happens quickly and severely. Burns, scalds, cuts, or pressure sores can become very severe without these important warning signals, as you don't stop or remove yourself from the source of the damage. Shoes and AFOs might rub as the child grows or their foot shape changes and need to be replaced quickly. Help children develop good habits of checking areas of their body they can't feel, such as the feet, including the soles and heels and the backs of their legs. Use mirrors for areas that are difficult to see and discourage children from going barefoot, for example, in PE. Reduced circulation can mean damage to the feet or legs can take longer to heal, another reason why infection and sores can develop quickly. The calf muscles roll in walking is to pull up the heel, which pushes the weight onto the front of the foot, driving you forward. Where the nerves to the calf muscles are affected, children may walk by using their hip muscles to pull the whole leg up side to side. This is tiring and can be uncomfortable. There might also be visual perception or motor planning issues, which can make it harder to get around. Walking ability and style may change as the child grows and gets heavier. Excess weight gain should be avoided if at all possible. PE, sport and exercise is good for the health and good for social relationships. It should be fun and it should be inclusive. Support to the ankle and sometimes across the knee can support the joints where the muscles may be weaker and prevent tripping. Ankle foot orthoses or AFOs can also help keep the foot in a good position. Weight bearing is good for bone strength, which can become a problem in later life. Tethered cord is a condition where the spinal cord is stuck in the spinal column and stretches with growth, leading to mobility problems, bladder and bowel issues. When we're born, the spinal cord ends at the bottom of the back and should ride up inside the spinal bones to end up in adulthood around waist height. Children with spina bifida may have the tethered cord, where the spinal cord is stuck down by scar tissue or a fatty lump and cannot ride up. Tethered cord can lead to reduced mobility, reduced skin sensation, bladder and bowel changes, pins and needles, back or leg pain, and sometimes headaches since the spine and brain are joined. Surgery is often needed to detether the cord, so flag up any changes you notice, as the earlier issues are addressed, the better. Balance is complex and uses many of our sense and motor abilities. Without feedback from the skin or feet, or proprioception from our joints, it's harder to know what a surface is like or where our feet are exactly. Joints might be less stable where muscles are weaker. The way the brain processes information, for example, visual perception or motor planning, can make it harder detect slopes, steps, or stairs, or patterned carpets, and to navigate obstacles. Children need the opportunity to experience what their peers do, and sticks or crutches might help them balance while they do. A physio or OT should advise on the best option and ensure that they're the correct size. It's very important that children are not left in pain. Over time in pain, pathways of the brain can open up and result in chronic pain. The brain then detects pain long after an injury is healed. This is not imaginary. Anxiety increases pain, so keeping anxiety levels down with relaxation techniques or opportunities to discuss their fears can help. Lack of skin sensation doesn't mean pain can't be felt in the bones or underlying tissues of that area. As well as physical aspects of spina bifida, such as continence issues, children might have more anxiety or depression. They might be anxious about their health. Periods of time away from school for surgery or illness can make it harder to sustain friendship groups and keep up with schoolwork. Some cognitive effects of spina bifida, like difficulty in thinking ahead or managing change, might cause anxiety. Difficulty focusing attention or switching between tasks can make it harder to excel at schoolwork, and difficulty with the sense of time passing can mean they get told off for daydreaming when they should be concentrating. Children may struggle with their identity, identifying as non-disabled, but struggling to keep up and feeling isolated that their issues are largely hidden or private. Not all, but some children with open spina bifida will have some cognitive changes. They are often subtle, such as the use of language, flexibility, and managing change, or taking longer to focus attention or switch to another task than their peers. Short buffer zones between tasks with a little bit of notice, for example, in a minute we will stop doing this, can prepare for the transitions. There can also be difficulty using basic skills, such as handwriting or reading, to do more complex tasks. So handwriting may deteriorate from a handwriting exercise to writing a story. Similarly, word recognition may be good, but there might be difficulty with what a text actually means or finding the most important points. Sense of time can be a problem. They might need some support to manage their time during a task. Putting support in early can stop children falling behind so they can shine and really thrive. And do take any opportunity to help children feel good about themselves or their lives. Strategies for similar specific learning issues, such as autistic spectrum disorder and ADHD, can work really well. Older students might need help to break large projects into smaller, manageable tasks and to help keep track of deadlines. Shine has a great deal of information to be found on the website, and we can be contacted on 01733 555 988 if you have any questions or would like to know more. Thank you.